Pyoderma, demodicosis, and fungal dermatopathies. Pyoderma is a bacterial skin infection and it's often pyogenic. The gram-positive causes are Staphylococcus and the gram-negative causes are Pseudomonas, especially Pseudomonas aeruginosus and Proteus vulgaris. The types are surface pyoderma, superficial pyoderma, and deep pyoderma. Hotspot superficial pyoderma is moist dermatitis. It can come from fleas, otitis, and allergies. And intertrigo surface pyoderma comes from warm, humid falls, especially on the face and tail. In superficial pyoderma, we have impetigo and folliculitis. For impetigo superficial pyoderma, this consists of pustules and crusts in young dogs. For folliculitis superficial pyoderma, this consists of papules and pustules and you treat for 3 weeks. Deep pyoderma is caused by Staphylococcus pseudointermedius, as well as demodicosis and foreign bodies. And to treat interdigital pyoderma, it requires drainage, saline baths, and antibiotics. The treatment for pyoderma is to address the underlying cause. You can use antibiotics such as amoxicillin clavulanic acid and enrofloxacin. And there are also topical antibacterial shampoos, such as chlorhexidine. Demodicosis is a skin disease caused by Demodex canis in dogs or Demodex cati in cats. The forms in dogs are localized, generalized, and juvenile localized demodicosis. In localized demodicosis, we can see alopecia and scaling, and it spontaneously resolves. In generalized demodicosis, we can see lesions on the head, trunk, and limbs, and it can involve pododermatitis. In juvenile localized demodicosis, it resolves without intervention, but you can give topical shampoos and moxidectin. For the treatment for demodicosis, if it's localized, you can observe if it gets better or give topical therapy. And if it's generalized, you can give topical treatments such as amitraz dibs, or if it's oral treatment such as ivermectin. And if there's pododermaticosis, it may require long-term antibiotics for secondary pyoderma. For fungal dermatopathies, there's superficial mycosis, which has ringworm, which is also known as dermatophytosis, as well as candidiasis and Malassezia dermatitis. Ringworm or dermatophytosis is caused by Microsporum canis. The signs are alopecia, crust, scales, and miliary dermatitis in cats. We can diagnose using fungal culture or a Wood's lamp. In candidiasis, the cause is Candida albicans. It's secondary to immunosuppression. And for Malassezia dermatitis, the cause is Malassezia pachydermatitis, and it's associated with allergies and endocrinopathies. Subcutaneous mycosis is caused by sporotrichosis, and systemic mycosis is caused by histoplasmosis. To treat fungal dermopathies, if it's systemic, you can give etronidazole, and if it's topical, you can give imaverol, and if it's Malassezia, you can give ketoconazole.